When should I be concerned about a morning blood pressure surge? Have you ever wondered why your blood pressure might spike in the morning? This is a common question, especially for those managing hypertension. A morning blood pressure surge typically happens between 6 in the morning and 12 in the afternoon. This rise is a normal response as your body wakes up and prepares for the day. However, it can become a concern if the surge is too high, particularly for individuals with hypertension. So, when should you start to worry? If your morning blood pressure reading shows a significant increase from your normal levels, that's a red flag. For example, if your usual reading is 120 over 80 millimeters of mercury, and it jumps to 123 over 82 millimeters of mercury, that's generally acceptable. But if your blood pressure rises from 149 over 91 millimeters of mercury at night to 166 over 100 millimeters of mercury in the morning, that's alarming. Why does this matter? An exaggerated morning surge can increase your risk of serious cardiovascular events like strokes and heart attacks. In the early morning, your cardiovascular system is more vulnerable due to factors like increased blood clotting and changes in blood vessel function. There are two main patterns to watch for. The first is persistent high blood pressure from night through morning, known as nocturnal hypertension. This pattern can lead to ongoing organ damage. The second is the morning blood pressure surge, where blood pressure drops at night but then spikes sharply in the morning. This pattern is also linked to a higher risk of strokes. To manage hypertension effectively, monitoring your blood pressure in the morning is essential. Using ambulatory blood pressure monitoring or taking home measurements can help you identify these concerning patterns. An exaggerated morning surge often indicates increased arterial stiffness and other heart-related issues. Here are some practical tips for managing your morning blood pressure. First, measure your blood pressure at home each morning to catch any abnormal surges. If you notice consistently high readings or significant increases compared to your nighttime values, consult your healthcare provider. They may suggest adjusting your medication timing or type to better control your morning blood pressure. Additionally, managing other cardiovascular risk factors is important. Focus on improving your sleep quality, reducing stress, and adopting healthy lifestyle habits. In summary, be concerned about a morning blood pressure surge if the increase is large and sustained, especially for those with hypertension. Monitoring and managing this surge is key to reducing the risk of cardiovascular complications and protecting your health.